Jasmine is a speech-language pathologist at the Parkinson and Movement Disorders Clinic in Victoria, British Columbia, where she joined forces with the neurology department to provide new specialized services for patients with neurological movement disorders. Jasmine obtained her Master of Science in Speech and Language Pathology from the University of British Columbia, following her bachelor degree in psychology, philosophy, and speech sciences at the University of Calgary. Prior to being the speech-language pathologist for the Parkinson and Movement Disorders Clinic, Jasmine worked in acute care across the South Island hospitals. Jasmine is passionate about providing evidence-based care to the Parkinson's community and finding unique ways to help underserved patients across speech pathology services. Welcome, Jasmine, and it's nice to have you here, and I'll pass it over to you now.
Fantastic. Great. Thank you so much. Hello, everybody, and welcome to our Speech, Swallow, and Communication series. As Alana said, my name is Jasmine, and I'm here today to talk to you about swallowing and saliva management. This is actually part 1 of 3 in our series. Next week, we will be talking about speech and voice. And the Thursday after that, on February 18th, we will be talking about language, cognitive communication, and we will have a guest speaker to talk to us about technology and Parkinson's disease. So before we get started, I would like to thank Parkinson's Society BC. So I work out of a speech pathology program, which is generously funded by Parkinson's Society BC. I would like to take a moment to share our sincere gratitude because for those of you who may not know, PSBC is a non-profit organization. So we are honored that they chose to establish this speech pathology program for the Parkinson community. PSBC works to empower the Parkinson's community in British Columbia through providing resources and services such as this one to enable self-management, self-reliance, and self-advocacy. If you haven't already, I encourage you to check out their website at parkinson.bc.ca, which has many resources and opportunities to donate. So the clinic I work out of is in Island Health. Specifically, it's a new neurology clinic called the Parkinson and Movement Disorder Clinic, where I work with Dr. Tuck. I'd like to take a moment to thank Island Health as well and the clinic for their support in helping Island Health Parkinson community access speech pathology services. Finally, I would like to take a moment to thank Parkinson Wellness Project, or PWP. The speech pathology program would not be possible without their support either. So PWP is also a nonprofit organization whose goal is to improve the lives of those affected with Parkinson's disease. We are very grateful for their generous support, which has provided a clinic space to house the program. I encourage you to visit their website as well at parkinsonwellnessproject.org for more information about their multidisciplinary programs and other opportunities to donate. All right, so a bit about me. As Alana mentioned, my name is Jasmine. I am a registered and certified speech-language pathologist. As she also mentioned, I started my journey out in Calgary, and then I went west to the beautiful University of British Columbia, where I got my Master of Science degree. I kept going west and ended up here on Vancouver Island, where I worked in the South Island hospitals, and now I'm very happy working at the Parkinson and Movement Disorder Clinic at Royal Jubilee Hospital. So I want to get to know you all a little bit better. So if you have access to your chat box, feel free to type yes or no. The question is, how many of you already know what speech-language pathology is? Maybe you've seen a speech pathologist before, or maybe you've heard of us or not. So I'd love to see your answers. I'm going to give you a few moments to type in your chats. I'm just realizing I don't know if I can see the chats from my screen. All right, I'm seeing some here. I see some yes, some no. Okay, good, good. Getting to know where we're at. All right, so a good mix so far. Well, you're all in the right place. For those of you who are answering no, I will be starting the presentation about what is speech pathology and what we have to do with Parkinson's disease. Then we'll get into the swallowing portion, the saliva portion, and at the end, as Alana mentioned, we will be talking about some questions. All right, good, great participation, you guys. Okay, so by the end of this presentation, there's some things I hope you will have learned. So I'm hoping you will have better awareness of speech pathology, as well as swallowing and saliva management, and some strategies you can use. Most importantly, though, I want you to feel empowered in pursuing speech pathology services, either for yourself or your loved ones. So, I do have to give a quick disclaimer, of course, so please keep in mind this presentation is for informational purposes. So if you have questions about your individual diagnosis or treatment, please seek the care of a health professional near you. All right, let's get into it. What is speech pathology? So in Canada, a speech pathologist will have a master's degree or equivalent. Sometimes we're called a therapist, sometimes a pathologist, sometimes speech and language. They're kind of used interchangeably, and I will probably say both throughout the presentation. Technically, our name, though, is a registered speech-language pathologist. So if you were to Google speech-language pathology, you might see pictures like this come up, and that kind of reflects the general perception that we work with kids, perhaps on speech sounds or stuttering. And while some of us do work in those areas, the truth is we actually work across the lifespan. Okay, so we don't just work with children, and we don't just work with speech sounds. In fact, we work in communication in all of its forms. So that includes language comprehension and expression, as well as reading and writing. We also work with any part that really has to do with the face and the throat. So that'll also include eating and drinking and saliva management. There's other areas we work in as well, like social skills, hearing, things like that. So that means we work with a large population. You might find us working with people who've had brain injuries or stroke, or cancers of the mouth and throat where they had certain parts of their anatomy removed, cleft palates, premature babies, dementia, intellectual differences. We work in all sorts of areas. So that's all great, but what does that have to do with Parkinson's disease? And turns out a lot. So in Parkinson's disease, some people will develop changes in the main areas a speech pathologist specializes in. So that includes speech and voice, swallowing, saliva management, and language and cognitive communication. Now, a lot of people are surprised to hear how prevalent these changes actually are. So according to the literature, the majority of people with Parkinson's disease will at some point develop a change in these areas. Now, I do want to let you all know, as a gentle reminder, everyone's different. So for some people, these changes may be quite mild, perhaps to the point where they don't really even notice it. But for other people, it can be quite profound and maybe a priority in their care. So I'm going to do a little test your knowledge back to your chat box with a true or false. So what do you think? Are changes in communication and swallowing late to develop in Parkinson's disease or not? True or false? I'll give you a few moments here to put in your answers. What do you think? Are they late to develop? False. All right, we got some false answers here. Good. Excellent participation, you guys. So fun. Good. All right. So the answer, false. Good. Great work, everybody. You've done your homework. So while it's true that communication and swallowing can progress with time, for some people, these may have been the first changes they noticed. Okay, and that goes back to the point. Everyone is different. But with numbers that high anyway, the Canadian Guideline for Parkinson's Disease has explicitly stated in both editions that speech and language therapy is essential to Parkinson's patients' quality of life. And the reason for that is there's things we can do about these changes. So don't be shy about reaching out for speech pathology services. Sometimes if we can do early intervention and treatment, you might have better long-term outcomes, all right? And I'm also going to take a quick moment to address this question, which comes up quite a lot. Is there any medication options for these changes? And that answer is kind of tricky. So while medications can be optimized and have indirect effects on your speech and your swallowing, the truth is they're not specifically geared for those functions. So for some people, even when their medication is absolutely as best as they can get it, they might not notice huge improvements in their communication and their swallowing. So what I tell patients is you might still need a speech language pathologist, okay? All right, now we can get into the main part of the presentation. So we're gonna start off with swallowing. Okay, so I'm going to break it down into a few parts. We're going to have our introduction. I'm going to talk about how it relates to Parkinson's disease, some of the symptoms and risks, and then what a speech pathologist can do in terms of assessment and strategies. All right, so when I talk about swallowing, I'm really talking about the whole process of eating. Okay, so that includes the feeding stage, so bringing the food and liquid up to your mouth, the oral or mouth stage where you're doing the chewing and collecting all the food together, the throat stage, so the part most people think about where it's going down your throat here, but also the esophageal stage. So your esophagus is the tube that connects your throat to your stomach, okay? And so that whole process, we're talking about the whole system of eating and drinking. Now, it's more complex than most people realize. In fact, the mouth and throat stage alone require at least 40 different muscles and 7 cranial nerves. So that's a lot of parts of the body to coordinate and have good strength and timing for a good, healthy swallow. Now, when they aren't working the way they should, you might hear the term dysphagia. Dysphagia is the medical word for basically swallowing problems, all right? Now, let's get into the anatomy, a quick little review so we're all on the same page. Here is a picture from the side of a person. You can see their nose and their lips on the left, the back of their head and their spine on the right. Okay, here I have circled the tongue. Yes, it is bigger than most people realize. The throat, you see at the back there. Now, here's the fun part. Where the circle is now, that is your air pipe. So that is the tube that goes to your lungs, okay, your trachea. And it's white and it looks like it's kind of a bit bigger on the bottom of your screen there. Now, unfortunately, in humans, the pipe that goes to our lungs is right beside the one that goes to our stomach. Okay, so the part that goes to the airway is in the front and to the stomach is in the back. All right, so we want the food and liquid to go behind the airway down to the esophagus. Now, I'm going to see if I can play a video for you guys. This is taken from the MBS IMP app. If there's any speech pathologists watching, highly recommend you download this app. It is excellent. Let's see, I'm going to switch over to video. All right, hopefully this is, let's take a look. All right, we're good, playing video. Okay, so here's a normal swallow. Pretty quick, right? So the white, that there is the food or liquid. Our tongue is controlling it in the mouth, and then it's pushing it down the throat. Now, do you see where the white is going behind the airway? All right, so the airway is actually lifting up and it almost looks like it's bending forward out of the way of the food or liquid so that the food or liquid can slide behind it to the stomach. All right, and this should be done pretty effortlessly in that smooth motion. Now, sometimes the swallow doesn't work the way we want it to. And now I'm going to show you an example of what an impaired swallow could look like. So I'll play it here. You'll see the food or liquid in the person's mouth. And where's it going? It's kind of getting everywhere, right? So we can see here that there's residue all across the tongue, might be uncomfortable for the person. We see some bits stuck around in the throat, but if you look at the bottom in the airway, you see a bit of white. Do you guys see that? So that is food or liquid that could potentially end up in the lungs, all right, especially if the person isn't able to cough it back up. We're going to watch it again here. So some of the food and liquid isn't going the right way. It's going in front and down to the lungs. We'll watch it one more time. And there you go. It doesn't look comfortable, and it's also dangerous. Okay, so I'm going to go back to the slides here. I'm going to see if I can click through. There we go. Okay, so how does this happen? How do we go from one swallow that seems pretty effortless and smooth to the other one that looked uncomfortable and dangerous? Well, let's think about Parkinson's disease for a moment. You may have heard the word dopamine before. Dopamine is a neurotransmitter, so it's a messenger that helps cells in the brain communicate with each other. Now, in Parkinson's disease, when we talk about dopamine, we're typically talking about a part of the brain called the midbrain. And that's the part of the brain responsible for movement, okay? Now, in Parkinson's disease, when we're not making enough dopamine, then the part of our brain relying on that dopamine that controls movement is also affected, okay? So this is where we get the stiffness, the rigidity, and the slowed movement in our arms and our legs, right? But think of the muscles in your face and throat. If they're also not moving the way they're supposed to be, that's going to affect your speech and your swallowing. All right, so just like your body isn't moving the way it used to, these muscles might not be either. But there's more than that. So we know Parkinson's disease isn't just about dopamine, and it's not just about that part of the brain. In fact, there's other things involved as well that affect the swallow. So thinking or cognition. In some stages of Parkinson's disease, it can be difficult to plan and organize things. So multitasking, putting food on your fork, bringing it up to your face, paying attention, remembering to chew thoroughly and that you've got food in your mouth and you have to be careful, that can become harder and make your swallow more dangerous. Sensation can also be changed in Parkinson's disease, where it's harder to feel the food and liquid as it's in your throat and in your mouth. You might also have changes in your esophagus. Again, that's the tube going from your throat down to your stomach. So sometimes what can happen is it's not getting the food down the way it used to. And so what ends up happening is the food hangs out in your esophagus longer than it should. Airway protection is another change that can happen and affect the swallow. So remember in that video how the air pipe lifted up and out of the way? Well, there's a group of muscles above it that also close like a gate, and they prevent food or liquid from going down the wrong way. Now, in Parkinson's disease, what can happen is those muscles aren't engaging either when they should or as strongly as they should. And then what happens is that gate's not closing and food and liquid can go down the wrong way. Coughing is the next point. So what a lot of people don't realize is a cough is a good thing for the body. It's your body's last resort of protecting the lungs, okay? So when things are starting to go down the wrong way and you cough, that's your body protecting itself and telling you, hey, something's going wrong. We've got to get this food and liquid back out again. So in Parkinson's disease, there's some literature saying that that cough reflex isn't happening as often as it should or as strongly as it should. So food and liquid could go down the wrong way and you don't feel the need to cough. And it's sort of like you're silently having food and liquid go down the wrong way, okay? Breath support is the next big one. So even if you are coughing, sometimes your cough isn't strong enough. It isn't as effective as it used to be at clearing the airway. So even though you're coughing, it's still in your lungs. So another test your knowledge. I think this is the last one. So if you haven't participated yet, here's your chance. So true or false again. Could someone with Parkinson's disease have swallowing problems and not know it? So I'll give you a moment to answer in the chat box. What do you think? Could someone with Parkinson's disease have difficulty swallowing and not know? All right. Thank you, John. Shout out to you. Always answering good. Good, everybody. All right, excellent. Well, like I said, you guys have done your homework. It's true. It is true that someone with Parkinson's disease might have problems swallowing and not know it, okay? This could be due to the sensation, right? So not being able to feel it. You're not coughing. Maybe you are swallowing's fine when really you're not coughing because of other things going on. So it is important to know that if family and friends are noticing certain symptoms, maybe you aren't eating as much as you used to, you're avoiding certain foods, then maybe it is time to go see a speech pathologist. So some things to look out for, I've listed here. We've got leaking. So if food and liquid is coming out of your mouth, or if you're having trouble chewing, if you feel like food or liquid is sticking, whether that's in the mouth or the throat, if you're coughing during or after meals, or you have a wet or gurgly voice after you eat, sometimes difficulty swallowing pills, or just general discomfort in eating and drinking can all be signs that you need to see a speech pathologist. But there's other more subtle symptoms that might occur. So fatigue, if it is exhausting to get through a meal, it's taking a lot of effort, then talk to your speech pathologist. If you've had weight loss, or you find you're not eating in front of other people anymore, maybe you are coughing more than you used to, or when the food and liquid is coming out of your mouth, or it's harder to control, you don't feel like enjoying the foods you used to with the people you used to enjoy them with. So there are risks, of course, if your swallow isn't working the way it used to. One of which, of course, is quality of life, but also you might not be getting the nutrition and the hydration you should be, all right? And that's a risk for your health. A lot of people, of course, think of choking. If your swallowing isn't as safe as it used to be, you could be at choking risk. But perhaps the one we see the most often in Parkinson's disease is something called aspiration pneumonia, okay? And this is due to the accumulation of food and liquid in the lungs. Now, that could be from one big event, where you choked and all the food fell down into your lungs, or it could be over time from little bits of food and liquid that keep going the wrong way. Now, aspiration pneumonia is important because the literature does indicate that pneumonia and associated problems such as infections or sepsis are considered the leading causes of death in Parkinson's disease. Now, something to keep in mind, just because bits of food and liquid could be going down the wrong way does not mean you will develop a pneumonia. In fact, we find that even people without Parkinson's disease, the general population, sometimes has bits of food and liquid go down the wrong way. Sometimes while we sleep, our saliva goes down the wrong way. But we don't all develop pneumonias. And the reason is, to develop a pneumonia, you need to have food and liquid going down the wrong way, and you need to have another risk factor present, okay? So the risk factors include poor oral care, and we'll talk about that in a moment, having an already compromised immune system, maybe inactivity, and taking part in activities which are dangerous for your lungs, such as smoking. Now, you'll notice a lot of these are actually in your control. So if you're taking good care of your teeth, if you're active, looking after your lungs, then you might be able to have little bits of food and liquid go down the wrong way and never develop a pneumonia. So we have to take into account individual factors when we're looking at your risk. Now, that oral care piece, I have to bring it up again because everyone gets confused when I say this. But the reason is we all develop bacteria in our mouth. That's part of the human condition. But if that bacteria builds up in our mouth, it can stick to the food and liquid we eat. But when it sticks to the food and liquid, if we don't have a safe swallow, it can go with the food and liquid down into the lungs. So now your lungs don't just have food and liquid in them, they also have bacteria. And that is the recipe for disaster. So brush your teeth thoroughly and regularly. Use mouthwash, floss your teeth, see your dentist. And this is important with or without teeth. So even if you wear dentures, you can still get bacteria build up on your tongue, in your cheeks, in your gums. So always look after your mouth, okay? So if you go and you see a speech pathologist about your swallow, there might be some things that happen. Sometimes we'll recommend that you include other specialists in your care. That might be a dietitian who can help if we're worried about malnutrition, Occupational therapy can sometimes offer adaptive knives and forks and plates to help you eat better, more independently. Dental professionals, but also ear, nose, and throat doctors or otolaryngologists, if we think there might be something anatomically going on in your face or in your throat. If we feel that the esophagus, the tube from the throat to the stomach, is having difficulty, we might recommend you go and see a gastroenterologist. Now, when a speech pathologist evaluates you, there's a few ways we can do it. You might get a clinical evaluation. So that would be when we take a look at how all your muscles are moving and working. We might have you eat or drink in front of us. And then the other option is swallow imaging. And this is the really fun one. I get really excited about this, but there's a few ways we can do it. So the first is a modified barium swallow study or video fluoroscopic swallow study. And this is where we take a video x-ray while you eat and drink. This is really fun because we can actually see where the food and liquid is going. We can watch it go down and you might be able to see it yourself. So that gives us a ton of information about your swallow. The other one is where we actually get a tiny camera and little flashlight on a flexible tube. And we put it in the nose. Yes, we put it in the nose and we put it all the way back to your throat. Then when it's in your throat, we can actually see the food and liquid going down. I promise it is not as uncomfortable as it sounds. All right, so there's options for us to see your swallow. And it's important for us to see your swallow because then it gives us more information about what to do next. So we can take a look and see how safe is your swallow. And if it's not safe, why is that? And then once we determine that, we can come up with next steps with you. Okay, so for some people, that's a texture change. So we might look at the images and say, you know, your swallow's safer when you eat these consistencies and textures and less safe when you eat those consistencies and textures. Sometimes, depending on the individual person, certain positions or angles of our face can help prevent food or liquid from going into the lungs as much. There's also rehabilitation options. So certain exercises might be appropriate to help improve your swallow. Another big point though is planning for the future. So this is an important discussion to have with your health team and your loved ones in the event that your swallow progresses and gets worse. So for some people, if their swallow changes a lot, they might not be able to get the nutrition they need, or they might have a lot of recurring pneumonias. In those cases, your healthcare team will want to make some decisions. For example, how are we going to feed you? And what risk are you willing to take? So in some instances, that might be tube feeding, whether temporary or permanent. In other cases, that might be eating foods that maybe aren't as safe for you, but that you really enjoy because that's important to you. So having these discussions ahead of time is important because you might change your mind as you go along, but involving your healthcare team and having your speech pathologist walk through these stages with you can be really important for both you and your loved ones, okay? So that's all great, but what happens if you haven't seen a speech pathologist yet? Or if you're on a wait list right now? Well, there's some things you can do today that can help make your swallow safer. The first one, I'm going to say it again, good oral care. The other is good positioning. So when you're sitting upright and you've got good back support, then gravity can help the food and liquid go down the right way. The other one is distractions. So if you're trying to eat or drink and there's TV going on and radio, someone's trying to talk to you, or you're trying to read a newspaper, your brain's got a lot of things to look after and think about. Whereas when you just focus on what you're eating, you can concentrate on that and help make your swallow safer. The next one is something we could all benefit from, probably myself included, but taking slow and small bites and sips, okay? Take your time, be careful, that's okay. The last one is to monitor for signs of chest infection. So if you have a fever or colored secretions or congestion, that could be a pneumonia, but it could also be something else. So talk to your doctor. All right, next, saliva management. Are we ready? Here we go. So I'm going to talk a bit about some terminology, risks and why they happen, and then some strategies. So when I talk about saliva management, I'm talking about both extremes. So that's dry mouth and that's also drooling, okay? Now, someone with Parkinson's disease might actually have both. All right, you might find that at some times of the day your mouth is really dry, and at other parts of the day you're drooling. That's pretty common, all right? But there's some things we can do about it, and I'll get to that. First, I want to go over the risks. So either extreme, dry mouth or drooling, has risks associated with it. Of course, quality of life, if it's uncomfortable or getting in the way of your ability to do activities you enjoy, but also eating and drinking can be harder. And that, again, can increase your risk for malnutrition, dehydration. The other thing about saliva, fun fact, is it's one of the first stages in the digestive process. So it helps us break down sugars and fats in the food and liquid we drink and eat. So it's important we have saliva for that because it also helps with our taste. So if you're having changes in your taste, maybe it's because of changes in your saliva as well. Oral health, this is another big one that takes people by surprise. So saliva is important for the health of our mouth. It can help prevent tooth decay. It can help in the process of repairing tissues. Antibacterial, helps support a good pH level in the mouth, prevent bad breath. All these things that saliva can help with. The next one's lung health. So when we think of drooling, we typically think of saliva coming out the front of our mouth, right? Maybe dribbling past our lips, maybe onto our clothes or the floor. But it doesn't always go that direction. Sometimes the saliva pools and goes backwards. Now, when that happens, it goes into our throat. And if we have issues with our swallow, which we were just talking about, the saliva can go into your lungs, okay? So having good saliva management can help with lung health too. And then speech. So if your mouth is really dry or you're drooling, it's going to be harder to communicate. So what are the causes? Well, in the terms of drooling, a lot of people are surprised to hear that in Parkinson's disease, you're actually producing less saliva, not more. The problem comes in that the saliva you do produce, you're not swallowing as often as you used to. So a lot of us, when we swallow, it's automatic. We don't really think about it. We're doing it during the day, and it's controlling the saliva amount in our mouth. But if you're swallowing less than you used to because of the Parkinson's disease, the saliva you do produce is going to build up. Okay, and when it builds up, that can lead to the drooling, especially if you have other factors such as a poor lip seal. So if the muscles of the face are changing and our lips aren't closing, that's an opportunity for the saliva to come out. Reduced sensation, which I briefly mentioned in the swallow section, but if you're not feeling the saliva in your mouth, you're probably not going to swallow as often as you used to. Posture, so in Parkinson's disease, we typically have that head forward posture. Right? So that's going to be gravity working against you versus if you were sitting upright. Okay, the next is a cognitive component, and there's a lot of literature coming out about this. So the attention that we pay to our swallow might not be there. So what can happen is it's difficult when you're multitasking, maybe you're doing other things, and remembering to swallow your saliva while you're doing them. Right? And then medication. So sometimes it's a medication side effect that's causing the drooling as well or contributing to it. So good news, there's things we can do. All right. In terms of strategies, some people find that chewing gum or sucking on ice chips can help enhance the amount of times they swallow. For other people, it might be behavioral changes. So on your phone, you can put a little timer so that it vibrates every few minutes, and it can be a little reminder of, hey, I probably need to swallow because my saliva is going to keep building up. For some people, they actually find that wearing sweatbands on their wrist can help because they can then just wipe the saliva away without drawing attention to themselves by grabbing a bunch of napkins or towels. There are products available. Typically, you will need a prescription for these. But for example, there's drops you can get. And you drop them underneath your tongue, and it helps control the amount of saliva you produce. Medication changes, you can discuss that with your physician if you are on a medication that has a drooling side effect. And then injections. So if you have a certified professional, typically a neurologist, you can actually get Botox injections into your saliva glands to help control the drooling. All right, and then a next step would typically be surgical management that we can do for the saliva glands, but those are usually reserved for cases where the other strategies aren't working or more extreme ends of drooling. Okay, so do consult your doctor, consult your dental team, and your speech pathologist. All right, next is dry mouth. So what causes dry mouth then? Like I said, you're not producing as much saliva as you used to, so there's one right there, but also reduced sensitivity to triggers. So typically, if you smell really delicious food or you know you've got your favorite dinner coming up, your body's going to start producing more saliva in anticipation of that. Now, in Parkinson's disease, that buildup of saliva in anticipation from the trigger, it doesn't happen the same way it used to. So some people might be experiencing reduced smell or taste, so they don't have the same trigger saliva production they used to. And then, of course, again, medication. So some of the medications that are prescribed in Parkinson's disease can have a side effect of dry mouth. So when we think of these together, you've got medication that could be contributing to dry mouth. You're not producing saliva as often as you used to, and when you do produce it, it's not as much as you used to. So dry mouth results. Again, though, there's some things we can do about it. So interestingly enough, for dry mouth and drooling, some patients find benefit from chewing gum, sucking on ice chips, or sugar-free candies. If you find your dry mouth occurs mostly at night, you can try having a humidifier by where you sleep. There are also products available. A lot of these are over-the-counter available at Shoppers Drug Mart or London Drugs. I have some here to show you guys, but you can get different toothpastes and gummies and basically just oral lubricants that can help with saliva production. One that's pretty common is called Xylemelt. So I'm going to hold this up so you can see. Xylemeltf. And they look like little Tic Tacs. Okay, but what you do is you stick them in your mouth, typically on the back, just above a tooth, and they melt slowly. So it's like you have a nice steady stream of lubrication in your mouth that you don't have to think about. A lot of people will use these at night or during the day if they're busy with other things, okay? You don't have to think about it, stick it and leave it, all right? So again, consult your speech pathologist, your dental team, and your physician. All right, now I'm going to give you some resources. If you walk away from this presentation and afterwards you're like, oh, I forgot to ask that question, or you just want more information, there are resources available to you. Some of them are free, which is always a good thing, but both the Parkinson Foundation and Parkinson's Society BC have free PDFs on their website. Go check these out, okay? You can download them. I have their websites here, but if you want, I can find a way to get the link in the chat box too. So if you have more questions, want more information, you can check those out. Again, free. And then if you want to access a speech language pathologist, there's two ways you can do it. So publicly, you can get a referral. Some hospitals will have a speech pathology outpatient program you can go to, or if you're part of a movement disorder clinic, they might have a speech pathologist you can access. Privately, there are some options too. You can find them through Google or the Speech and Hearing BC website, which has a little button. It's going to be on the top right that says find a professional. Okay, if you click that, it'll give you a list of the speech pathologists in your area who are currently accepting clients. All right, so next we can do questions. Alana, if you want to come back and we can see if anyone had some more questions, we can do that. Oh, I see some right away. Is it advisable to eat? Oh, go ahead.
Oh, did you want me to read the question or did you want to go through them?
I see two right away that I can answer, but if you want to see if there's other ones in there, that would be great.
Sure, I think it's just those two for now.
Oh, perfect. Good. So I see, is it advisable to sleep with head of bed raised? It can be. Okay, so especially in terms of the esophagus. So again, the tube that goes from your throat to your stomach. If you're having issues with that, or if you have issues with reflux, heartburn, sometimes having the head of your bed raised can help. Okay, and this gets into another topic that I'll briefly mention because I feel we might have time for it. But if you have reflux, that can be dangerous for your lungs as well. So sometimes for some people, little bits of reflux can go all the way up into their throat. Now, when that happens, it can irritate the tissues, but for some people, it can also tip forward into the lungs. And then you're getting the stuff from your stomach or the stuff that was stuck in your esophagus into your lungs anyway. So for some people, sleeping with head of bed raised helps with that. I would consult with your healthcare team to make sure that's right for you. The next one I see, is it advisable to eat more fluid foods rather than dry? If you have dry mouth, yes, or if you have chewing problems, perhaps. So again, texture modifications, I would typically want a speech pathologist involved. But if you have dry mouth and it's hard to get it down, you might find that you need to use things like sauces. Or if you're having difficulty chewing, you might find you prefer softer foods. But again, that depends on the individual, right? So a lot of these questions is going to have to depend on your individual circumstance. What is the name of drops for too much saliva? Atropine. Do I have a sticky note so I can write this down? I do. There we go. All right. So you do need a prescription for these. Heads up. Talk to your doctor. I'm going to write this down so that I can hold it up and show you. Ooh. Oh, it's too bright. There we go. ATROPINE, drops. Those are the ones, okay? Hopefully that's helpful to you. Talk to your doctor about those. Impact Parkinson's also has a voice therapy group. Awesome. Yeah, if you know any resources, feel free to share. For a lot of these voice therapy groups, just a heads up, I typically recommend seeing a speech pathologist first, okay? And there's a pretty good reason for that. So some people who come into the clinic, they have problems with their speech and voice, and it might not just be because of the Parkinson's disease. It could be something else on top of that, okay? So your speech pathologist can typically assess you, and they can see, is it that you need a voice therapy group? Or do we need to get, say, an ENT involved to take a look at the vocal folds because something else could be going on as well, right? So if you have a history of smoking or you are a singer in a heavy metal band, right, you could have other issues going on with your vocal folds that are also impacting your voice. So just joining a speech therapy group without being assessed, you might not get the benefits you intend, but depends on the person. Any exercises to do? I thought this would come up. Okay, so when it comes to exercises for the swallow, I'm assuming you're asking, I like to do those with imaging. So every swallow can be different. For some people, it's different parts of the mouth or throat that are being impacted. So an exercise that targets muscles for one person might not be the muscles another person needs help with, okay? So your speech pathologist would have to image you and take a look at which muscles they might recommend, or at least talk to you about what's going on so they can figure that out. There are some voice exercises that I will try to review in next week's seminar where we talk about speech and voice in case those were the kinds of exercises you were talking about. Oh, you guys are typing too fast. I got to scroll up. Here we go. Details are here, impactparkinsons.com. Thank you so much. Excellent. Good. And then I see another one. If I tip my head forward to swallow, is this advisable? Chin tuck. Okay, yes. So I get asked about the chin tuck quite a bit. That's essentially a strategy or a maneuver where you put the food in your mouth and you tilt your head forward, then you swallow. Okay. For some people, this is the recommendation they get from their speech pathologist. For other people, it's not. I would suggest talking to your speech pathologist, right? Because here's the thing, if you're tilting your head forward and you aren't supposed to be, the risks of having food and liquid going down the wrong way are pretty high and substantial compared to going and seeing a speech pathologist and having an individual evaluation. Now, if you have had a speech pathologist or a health professional tell you to do that, then that's for you. But in terms of addressing everyone here today, I do recommend seeing a speech pathologist. Can you tell us more about wet voice? Yes. Okay, so if you had a food or liquid and your voice sounds gurgly, you know, like you're talking through a puddle perhaps, that could be because a little bit of the food and liquid is hanging out right above the airway. okay? Because right above the airway are your vocal folds. That's how we talk and make sounds. So if the food and liquid's right above the vocal folds, you get that wet quality. But that also means they're pretty darn close to going down the wrong way into your lungs. So that's why that's something we watch out for. Some people will be advised to do things like clearing their throat when they're eating or drinking, or doing coughs, extra swallows, things like that might help with some people. Yes for swallowing. Oh, was that in response to exercises? Okay. Where can you contact public speech pathologist? So you can get a referral. If you have an appointment with your family doctor, they can send you a referral. Like I said, there's outpatient clinics at various hospitals. On the island, there's Victoria General Hospital. I believe Nanaimo has an outpatient program. So what would happen there is you'd get your referral. It would be sent to the speech pathologist public outpatient clinic. If they have a wait list, you would go on the wait list, but then they'd contact you to book an appointment, and they'd assess you, and depending on your needs, they will decide a plan from there for you. Heidi, yes, the group is led by a speech language pathologist and has one-to-one assessments. Awesome. Yeah, go check that out then, guys. I love to hear that. More opportunities for speech pathology, the better. All right, good. Okay, were there any ones that I've missed? Alana, do you see any that I've missed?
No, I think you have answered all of them so far.
Okay, good.
So we still have some time. If you all have questions, please feel free to type in the chat box. Okay.
Oh, nice.
There was that, yeah, you did that. Can you tell us more about wet voice?
Yes, so that's the food and liquid hanging out above the vocal folds.
Yes.
Oh, my hope of restoring voice due to reflux. Yes. Okay, there are things you can do about that. So if you have reflux and it's impacting your voice, perhaps it's irritating the vocal folds and changing the way your voice sounds, there are things you can do. Yeah, so you can get ways to control the reflux. So sometimes that's medication management, sometimes it's behavioral, so just eating slower. You might get that head of bed recommendation where you sleep slightly with your head of bed elevated. Staying upright after you eat and drink, right? So if you eat and drink a ton of food and then you go lie down on the couch, well, gravity, again, so important. It's not going to help food and liquid go down to the stomach. So things like that help reduce the reflux can help with the voice. I believe in Vancouver, there's actually a clinic dedicated to voice with speech language pathology. So you can check that out. Is it better to eat small pieces of food? Typically, yeah. So again, a lot of people are guilty for this, but eating a lot of food really fast, it's going to take more coordination. It's going to be harder on the swallowing system. And if you have any issues with reflux or heartburn, it's going to be harder on the esophagus. So slow and small bites and sips. I see another question here. Aspiration pneumonia. Already been hospitalized for aspiration pneumonia and have dementia. What is the best way to prevent another episode? So if you were hospitalized, I'm hoping you were seen by a speech pathologist and hopefully given some recommendations. Those safe swallow strategies I listed earlier, minimizing distractions, upright positioning, things like that can really help. In terms of the dementia, if you're having trouble remembering those strategies, write them down and put them where you sit to eat and drink. Right? So don't be afraid to just write out a list of the recommendations from your speech pathologist and put it there while you eat and drink. Maybe ask somebody to help remind you to do those things. So, you know, telling somebody, hey, if I start eating too fast, can you make me slow down? A trick that I like is when you take a bite of food, I'm using a pen because I don't have a fork, take a bite of food, put it down and let it go. Sit it on the plate until you've completely swallowed. Then pick up the fork again, okay? Because otherwise we start to shovel, right? And we haven't actually swallowed the food that's in our mouth before we're taking another bite. So put your fork down, let it be until you've totally swallowed. And that way you're forcing yourself to slow down, right? Okay, so more questions are coming in. I'm just scrolling up so I don't miss any of them. Is it better to sleep on your back or side regarding choking? I don't know necessarily if, I guess there are some issues where if you're sleeping on one side, it can make the reflux worse depending on how you're positioned. But usually if it's for the choking, are you talking about reflux or talking about choking on your saliva? That might change my answer a little bit. Sometimes I get patients who say they feel like they're choking on phlegm or buildup of saliva in their mouth. And interestingly enough, that again has to do with dry mouth. So what can happen is if you're not producing enough saliva, the saliva you do produce gets thick, right? And when it gets thick, it creates that phlegm. And then as you're sleeping, it can kind of collect back here and people will get that choking feeling. Some good ways to deal with that might be to try something like the Saliva mounts. I'm not affiliated with this company at all. I just think they're great. But doing things like that to help lubricate the mouth, humidification, right? And also when you wake up, some people will find that using mouthwash to kind of loosen things up can really help even before they brush their teeth, right? So you can use the mouthwash before you brush your teeth, then brush your teeth. Usually people do the mouthwash after they brush their teeth, and that's fine too because it lets the mouthwash stay on your teeth and protect them. But if you do it beforehand, it can help loosen that phlegm so you brush your teeth better. That was a bit of a tangent, but resources for nutritional pureed food recipes. Ooh, great point. There are some of those online. So I believe, does Parkinson BC have a resource for that? I feel like I've seen something before. But there are recipes you can go online and you can type pureed food recipes. And there's actually dietitians who have made nutritionally sound meal plans that involve softer food. So that's a good option. But also reaching out to a dietitian yourself can help with that too. Because when you're eating pureed food, you want to make sure you're still getting nutrition and the right amount of calories, right? Another person has said, I have lots of saliva and swallow frequently, yet feel like I have dust in my throat. Is that a Parkinson's swallow issue? Dust in your throat. Oh, I'd want to know more about what you mean by that. So does that mean you feel like you have a dry throat? Or does that mean you feel like something's stuck in your throat? So dry throat, that could be related to the Parkinson's disease and the dry mouth. If you feel like you have bits or pieces stuck in your throat, then that could be a swallow issue, perhaps where bits of food and liquid aren't all going down. And remember that video I showed you where the food kind of just went everywhere and was stuck all over the tongue and the throat? That could be happening, in which case a speech pathologist might actually be able to recommend techniques or textures for you so that you don't get that same amount of residue and it's more comfortable to swallow. Next question is, sometimes when I go to speak or sing, there's nothing coming out. So I'm doing the voice presentation next week. I do encourage you to register for that. I believe you have to register for each session individually. But yes, come to that one. Sometimes that could be due to just feeling so dry that nothing's coming out. Sometimes it could be breath support, so you don't have enough air. Sometimes it's to do with the vocal folds not coming together properly. So there could be a few reasons for that. Another person said, "What, are we okay for time?" Yep, okay, good. What can you say about using a thickening agent to avoid choking? Great question. You guys are awesome. Really good questions. So thickening agents. All right. Great for some people, terrible for other people. Okay. When you thicken food and liquid, that helps it go slower down the throat. Now, if there's a timing issue and your muscles aren't able to keep up with how fast the swallow is, and so everything's going down the wrong way, then thickening can help. But for some people, if it's a strength issue, so your muscles can't engage enough to push it down, then when you thicken the food, it's going to be more work for your throat. So it could actually be worse. Another thing to remember is thickening agents. For some people actually really like them, but for some people, they're not as appetizing. So this would be when, say, you get water and you thicken it, so it's more of a jelly consistency. An issue with that, though, is people tend to eat and drink less because they don't enjoy it as much. and the risks of dehydration or malnutrition might become more important than the risks of the swallowing. So it depends on the individual, right? So pros and cons. It depends on what the cause of the swallowing issue is and also what the person's risk is for dehydration or malnutrition. Choking on saliva, yeah, so that could be, like I said, sometimes the drooling's coming out the front, sometimes it's going down the back and down the lungs. Talk to your speech pathologist, definitely for that. Is it important to drink liquids with your food? Good question as well. So for some people, having liquids with their food can help soften the food and help it go down more comfortably, right? But for other people, the coordination required to control liquid and solid food in the mouth and get all of those muscles. Remember, there's at least 40 muscles, 7 cranial nerves. That can be way too much on the body. And so for some people, they actually need to avoid mixed consistencies. So they need to have liquids separate from solid food to be safer. But for other people, they actually need to combine them to make it more comfortable. So you might be starting to see the pattern here where the problem that's causing the swallowing issue is going to change how we treat it and how we manage it. Okay. What causes excessive yawning? It's a good question. That could be fatigue perhaps, but I would talk to your doctor about that. Let's see. Thank you. Okay. I find that my voice disappears when my meds are low. I think that might be a typo. I find my voice disappears. Oh, when my meds are low, perhaps you were trying to say. Yeah, so we have the voice webinar next Thursday. Today's was on the swallowing and saliva management. But next week, we're going to talk about voice. So we'll be discussing medication and voice as well. But yeah, for some people, they do find that fluctuations in their medication can indirectly impact their speech and voice. But at the beginning of the presentation, I did say that your medication isn't specifically geared for your speech and voice. So for some people, even when their medication's optimized, they still need to see a speech pathologist. But for other people, if say your medications help you control your movements better, you might have that indirect benefit on your voice. I tend to choke sometimes, but other times I'm okay. Yeah, it can fluctuate. It can fluctuate. So sometimes towards the end of the day, depending on your medication cycle, if you're feeling that on or if you're feeling off, that can influence it. Also, what kind of meals are you eating? So if you're having cereal for breakfast, but something soft like mashed potatoes for dinner, one might be easier and one might be harder. So you might find you're choking on one and not the other. Also think of the context. So do you typically eat dinner maybe with your family and you're all talking and multitasking and passing the salt, right? And then you might have more trouble eating versus if you like to have a nice quiet breakfast. Okay, so there might be other factors going on explaining why sometimes you feel like you're choking, sometimes you don't. So yeah, again, I'd have to assess you guys individually to be able to give you exact answers, but I'm hoping that some of these answers have helped kind of guide you or give you some more information.
We're at 2 o'clock, Jasmine, so I don't see any more questions. I want to thank you so much for taking the time to do such an informative presentation for us. And also, thank you so much for the very kind shout out that you did for Parkinsons Society BC. And thank you all for attending and some great questions there. And that always makes it much better as, you know, people learn from each other's questions. So thank you all for attending. And remember, you can still register for the next talk that is approaching. Registration is still open for that. So if you haven't done that already, please go to our website and register for the next 2 webinars as well. So thanks again. Have a great afternoon.
Thank you, everyone. Thank you, guys.